Good afternoon, everyone. This is Karadina Sale with the McSilver Institute, along with the Community Technical Assistance Center and the Managed Care Technical Assistance Center of New York State, and I would like to welcome you to today's webinar. This is our final offering as part of our series called Coping with Crises During COVID-19. This is part 5, which is our providers report. So we really wanted to share experiences from the field, and we are lucky enough to have 2 amazing providers join us, one of whom is having some technical difficulties, and we really apologize about that. We hope to get that sorted out right away. So bear with us for just 1 minute, and I'm hoping that we can make sure that we can hear Kellee Simone Barrett. While we're waiting, I'm just going to go through a few things with you. Everyone is muted, so we're going to ask you to do a lot of chatting with us today because let's see how many of you are with us today. There are a lot of panelists, and there are 130 right now that are with us. And what you are experiencing, what you have been doing during this pandemic is equally as important as what we're going to hear from our providers. So we're going to ask you 3 different Let's Chat questions, which I'm going to get to in a second. And so the chat piece, if you haven't been with us before, there's a chat bubble if you hover over the bottom, and on the right, you could click the chat icon, and then your chat will pop up over on the right. So that's where you will chat to us, and you can send to all panelists so that we can all be sure to see your thoughts and your responses. We do have a few resources that we're going to talk about, and we're going to have a handout that will be posted. At the end of our presentation, we will be putting these slides and those resources up on our website that will be available in a few days. And there's a survey that follows this webinar. We do ask if you can just take a second to fill it out. It's really only 3 or 4 questions, and we look at all of your answers to make sure that we are doing the best job of serving you. And finally, I want to just give a thank you to all of you who really are essential workers during this pandemic. We're so grateful for all that you do, and we know you're making a difference in the people that you're working with. Today, this is what we're going to cover. Within the context of COVID-19 pandemic, part 5 of this series will focus on experiences from this field. This offering, as I mentioned, will involve 2 providers, hopefully, at least 1 provider is definitely with us. Hopefully it's going to be 2. They're in direct services right now sharing their experiences. There will be a Q&A with them that will be facilitated by my colleague, Diana Arias. And then we're going to have several Let's Chats with my McSilver and CTAC colleagues and you, our participants. So the first one will be Let's Chat Promoting Safety with our clients. The second one will be Let's Chat Your Challenges, and then the third one will be Let's Chat Your Own Safety and Well-Being, so really thinking about your own experiences during this time and anything we can take away from this experience. So our providers report is going to begin now. I think we'll start with Lenny Bolivar, who is a licensed social worker and is working at ABC currently and has been in the field for many years. Lenny, I'm going to just briefly go through, find your slides really quickly so that you can introduce yourself in more depth and get started.
Thank you, Karen. Thank you so much for the invitation to this space. We're very excited to be here. As you mentioned, I've been working for the Association to Benefit Children for around 9 years. And for the last 5, I've been leading the Children Adolescent Model Crisis Team. For some of you that may not know, in a nutshell, the Model Crisis Team provides crisis intervention related to mental health to youth up to 20 years old throughout Manhattan. We do have a 2-hour response, so it's a very fast-paced team. We work from 8 a.m. to 10 p.m. 7 days a week. And we have a lot to share about, what's been going on with the pandemic. And one thing that I would say is that I'm a voice to a great teamwork that is, along with the work I do. So all of these that I'll be sharing is echoing the work that all our team does together. And we can go through the next slide. All right, so one of the things that we're going to share today is how we have seen our clients and families impacted by this COVID-19. we have definitely seen an increase in the abruption of attachment figures and meaningful relationships being separated for the youth. Here I say no access to a school community, which is not true. They still had access to a school community, but in a different way. And we have seen that, especially for the kids, that this happened in a way that, for one, it was abrupt. Secondly, I think we may have this image that all youth may be able to be tech and find their ways in the virtual world. That's not the case. So some of these kids were not able to access their community as easy, and that meant emotional distress. We continue to see suicidal ideation from our teens and self-injure in a different way, because of the virtual world. Perhaps we got more referrals from a school, being that a youth may have written an email to their principal or to their teacher saying that they had thoughts about hurting themselves, or they don't find a meaning in life, and then that school principal made the referral to us so we can help them out. But the source of these different situation could have or was a separation from their attachment figures of the relationships. We've also seen a lot of kids not being able to have access to their grandparents or family members because they were sick with COVID, which also meant losing family members, which I'm going to talk about in a second, and as well increasing the separation anxiety or fear of losing their own parents, right? Also, so that's kind of one bucket of the things that have been a pattern with COVID-19 and crisis. The other bucket is it has been youth that were or they are compromised with severe mental health diagnosis, and all of a sudden they don't have the same services. So we had youth that perhaps they were in the way of being connected to services, or they were in the way of being connected to day treatment programs or residential, and all of a sudden they're back home in circumstances that are difficult, right? So we had, for example, parents that for 2-3 years were not dealing with these behaviors day to day, and all of a sudden they are, all the family together, single parent household, having to navigate extreme aggression or extreme emotional difficulties, including like isolation, suicidality. And one of the things that happen many times with this decision making is that, especially at the beginning where we're trying to figure it out, and I would say still now, the calling 911 or going to emergency room was not definitely the safest way to go about this. So that's something that we had to navigate, and we continue to navigate right now. Along the same lines, having to share space with multiple family members that they're not used to spending time with, youth that are not used to spend so much time at home, and how that has created some tension in the family system. Sometimes this tension has resulted in physical altercations, for example, and how to navigate that, calling 911 for reasons that are not necessarily people being in immediate danger to themselves or others. And part of our role has been trying to navigate that and using the resources that we do have. It's been interesting because a lot of the times when we do supervision or when we talk, we have all of these ideas, and through COVID, it's been, well, that's not accessible. That program is not accessible, or going to the grandparent to take a break is not accessible. So we have definitely had to create very creative ways to navigate this way that our families have been affected. The difficulty managing and processing excessive news consumption, I think we have all been through this, and our families for sure, how the youth may have access to information that it's not necessarily conducive for them or not age appropriate, and you will see nightmares, like really fears for the things that they see. So a lot of our work has been trying to help parents in how to discriminate what information the youth should have. The other piece will be the shared loss that we have all as a community dealt with, really for young children and teenagers, seeing their family members die and not being able to have the rituals that they usually have. As I was thinking about it when writing the slide, death and losing people that we love is part of life, right? Like, as an event itself is not a crisis. However, not being able to integrate the grief to your life because you cannot have your community support, you cannot have the rituals, had created some sort of a complicated grief and a crisis itself by losing people we love this way due to COVID. Then we have the amplified frustration with family members, because especially for teenagers, they feel that they don't have control of their lives. And I have like two different examples here. We had a pattern of teenagers that lived with high-risk populations, and they wanted to go out. You know, they could not fathom staying all day at home. You know, you are also talking of homes that had very limited space. You know, some of the family members sleep on the living room, and you know, like arrangement that they had to do in small spaces. And we found that some of the teenagers' way of coping with COVID was minimizing the situation. So we had really difficult situations where family didn't have a lot of options, and they you know, how do you make a 16-year-old not go out, right? So that was one thing that we had to find ways to navigate with our families. And the other common theme has been the practice of radical acceptance in a way with our parents. You know, we also found parents of young kids that they tell you, you know, I'm doing everything I can. I'm trying to compensate. I play with him. I do everything so he has time to feel joy and go out. But, you know, the kids still meet their friends. And with some particular cases, they will tell you, yes, my mom plays with me, but I just really want to see my friends and, you know, touch them and have these meaningful times with them. So that was another piece of really talking with families, like no matter what you do, things will continue to be difficult. Then in the way that how we keep our clients safe, I'm going to go rather quickly around this one because I feel that we've all heard about the PPE piece, but we establish measurements around safety with PPE, social distancing when possible, because we know that, you know, the homes, we don't control how big or small the homes are when we do home visits, avoiding the use of the public transportation and hygiene standards. And this second one has been a very key framework for the crisis team that is really assessing the risk before going a face-to-face visit. This means kind of like crossing the high-risk nature of the crisis and if we have access to the youth, and determine if we can do the intervention with a virtual platform, which we have done as well. So we kind of developed like a triage to be able to see if we could do the work back virtually or we had to go face-to-face. We also had families where we did interventions over the phone because the family were waiting for a test to see if they were positive or not. So that was a very important piece of the work we have done. We have equipped our team with PPE so they can also share to the families. So we really encourage our staff when you go to a home, if the family is not wearing a mask, to kindly ask them to do so while you're there so we can all be safe. Creating an opportunity during the visits to provide psychoeducation around COVID, especially at the beginning when we were going to the homes. There was so much confusion. Parents didn't know how to access Zoom. All of this virtual schooling seemed like so far from their heads with all the stress that we also created that opportunity to keep them in a contained environment. And this one, last one but not least on this slide, and I think this is one of the most important one, will be the increase in staff support and supervision. You know, we're human beings. We are afraid too. We all as individuals have families and have our own anxieties around what this meant. And I think accepting that as a crisis team, we were also afraid and we're also part of it has been key to also assure that when we go out, we can help our families for sure. We can go to the next slide. And then a little bit about the clinical approach with the families. I like to say that our approach is a systems approach to safety. And look, this is something that we, like when I read this, we should always do that. Psychosocial stressors that impact us and impact the family are part of what we need to determine when we talk about safety. We do know that a youth crisis is determined by the environment oftentimes and the family approach. And when the family is weakened by lack of food, no job, you know, like the basic pyramid of needs is something that we need to look into. What happened before is that we had other providers, other systems that help us out with that, right, as a crisis team. So I would say that we had to expand our approach and really help people more in terms of finding food, or as I said in another point here that I'm going to talk about now, even talking with parents about advance directives. A lot of our families are single parents or that immigrants that they don't have family here. So what did they do if they get severely sick? We had even families that were very, very sick and they were not going to a hospital because they didn't have anyone to leave the 4 kids. So a lot of this conversation in terms of keeping them safe was like, okay, maybe should we talk about talking with your neighbor, talking with someone from school that can help you out, like helping parents to create some structure that will help them feel control over a pandemic that we don't know when it's going to end, which has been a big issue too for everyone. In terms of safety planning, really doing our best to work with what we have and access our natural coping skills. As we do know, when we are anxious, we segregate more cortisol. Our way of thinking gets a little bit more rigid. So oftentimes for parents, it's hard to see maybe some little things that can be accessible because of the natural situation. So when thinking about safety, including family strengths, even, thinking about, yes, you can go out, but perhaps you can go to the hallway and take a break of 5-10 minutes and go back and forth with your mask. Or we have situations where when this teenager didn't want to go out did want to go out every day of the home, help the parents reframe it. Okay, maybe you go with him those 20 minutes and create that time for you guys to bond. Like really looking into creating the natural strengths that the family have already as part of the safety planning for sure. And also a traditional safety planning of if this happened, I'm going to do this, and escalate it to a point of if their safety is in jeopardy, when do you need to call the crisis team again? When do you need to call 911? And all of that part. Definitely, we've been having more intense and frequent interactions with our families because they need it. There is no other communities or other supports that were alone. So I would say that we have been more intense in our involvement, and always keeping in mind having a trauma-informed approach. There is a big piece of how this micro crisis or the system crisis that we're dealing is a possible trigger for our families. So we have seen parents, feeling or experiencing trauma, and I think this will go align a little bit with what hopefully Kellee will talk about in terms of, DV population and other things that come out when people is going through an abrupt crisis with no ending, basically. We can go to the next one. All right, so lessons learned. I'm sure there are many more than what we have here, but I will share a few and let me know if I need to do this faster. But we learned that we're able to quickly adapt to challenges and continue to support our families. One thing that we're really proud of is the accessibility to the crisis services, like to the youth doesn't have to have a diagnosis to be referred. In the child world, we do know that a lot of the programs and all the services are amazing. They take time, they need a process, and with the crisis team, you just need to call us and we'll be there. And we do think that this avoids social exclusion in a time of shared vulnerability. We also know that as a crisis response team, we're not trained to specifically face situations as big as a pandemic. Of course, we're trained to deal with the uncertain situation, but there was a lot of rapid learning in something being so big, I would say. We also know that staff training, support, and recognition to our heroes and the people that continue there is key to be able to support our community in the best way. And we do know that, or we learned that we can be very flexible in terms of our clinical approaches and interventions, and how important that's been. One of the things that was very, it's a small thing, but it really stayed with me when doing a face-to-face assessment using a mask. There is so much that comes with the nonverbal cues, and with kids, you smile, you're sad with them. So we had conversations about, well, now when we meet, we need to tell them, I'm smiling with you right now, I'm being sad with you right now. I wish I didn't have to wear the mask, but that's okay because I'm going to tell you everything that I'm feeling or that I'm doing with my face right now. So even those little changes of looking outside the box on how we can create meaningful connection has been a beautiful learning as well. And lastly, we do know that we cannot do this by ourselves. That's a big thing that we know, but now we know even more. And we know that we need support. I think, the staff vicarious trauma that comes with continually going to the field through all this time is something that we want to continue to support our staff. We are also very connected with how oppression and disparity in the community has been in our face through all of this, knowing that the minorities have been the most impacted by the COVID-19, and we, that's something that's been very important for us to keep in mind through our work. And that we need continued support from governmental and non-governmental partners to be able to continue to reach every community and every kid that we can. And I believe that's it for me. Is that right, Cara?
Yes, thank you so much, Lenny. We're now going to hear from Kellee Simone Barrett. Thank you for sharing your raw experiences, Lenny. I think you did a fantastic job of really sharing with everyone today your experiences, as well as, how important safety was to you and how you really adapted to such a difficult situation. So thank you so much. We're going to now hear from Kellee Simone Barrett, who is finally with us right now. Thank you, Kellee.
You can hear me? Yes? Yay! I'm so excited. I was just having some technical issues earlier, but I'm glad that you guys can hear me. So just a brief background on myself. I have actually over 20 years of experience in the social service field. As you can see on the screen, I've had my master's degree from Columbia University, but more importantly, what I'm going to talk about today is my background with working with survivors of domestic violence, both in and out of shelter. I've been doing that for umpteen years now. I won't share my age, so I'm just going to say umpteen years. And so let's get into that. Can you change the slide, please? Next slide, please. Thank you. So one of the big things that we noticed when COVID first occurred was how the sheltering in place has impacted those that are victims of domestic violence. So a lot of them are now, were now confined with their abusers. So normally you would go out to work every day, you would probably go to school, or you would be able to go in the community, maybe go to a friend's house. But because of sheltering in place, that was no longer happening. And what we also found was the abuser was now using this to their advantage. So what they were doing was, if the person had to work remotely, they would say, well, you know what, I don't want you working remotely. I think when you're home, you need to be working you need to be home and doing things for the home. So this was now another way that the abuser would use this as an opportunity for them to control their victim. Or if the person now has to go to work because they were an essential worker, because unfortunately a lot of essential workers are also victims of domestic violence, because as we know, domestic violence has no limit to who is exposed to it. They would say, well, you know what, if you leave, then you can't come back in the household with my children because you're going to expose my children to possibly COVID. And so this now puts the person who's a victim in a space where they don't know what to do, because they need their income, they need to have their support. And again, now they're just forced to be in the space with their abuser. One of the things that the abusers also have done, which we've received in hotline calls, you have people who are fearful because the abusers say, you know what, I'm positive and you have to take care of me. And so, you know what, I don't want you to wear a mask. You can't wear anything to protect yourself because I'm going to expose you. And if you don't do this, I'm going to also expose your family members. So this put an additional fear on them and them not knowing what to do. And so a lot of ways, I'm kind of mixing these together, and I'm sorry, but being able to go out and get these resources is a way that a lot of people who are victims of domestic violence, they know that there are services out there. Some of people really, unfortunately, do not realize that there are services out there for victims of domestic violence. Some people did not know that the shelters were still open, even though COVID was happening. And this would have been information they probably would have been able to find out if they were able to leave to go to work, or they were able to still interact with people like they normally did. But instead, the abuser is now limiting the information and probably telling them, well, you can't. When you leave me, where are you going to go? Because the shelters aren't accepting people. And if you do, then what are you going to be exposed to if you go there? You don't know who you're going to be with. They may have COVID as well. And so when we began to get calls and you had people who were really thinking about coming into shelter, that was a big concern for them. They're like, yes, this is an unsafe situation for not only me and my children, but I have to share an apartment. So what do I know about the other person? How do I know that they don't have COVID? What are their cleaning? What are their cleaning styles? Do they clean regularly? How do I know that they're doing things to ensure that not only we don't get COVID, that they won't get it as well? So that was a huge thing. So you would have people who would actually complete the intake process with us, but be so fearful to come into the unknown and knowing that they have to share with someone that they would rather stay in their abusive situation. And they would tell us, unfortunately, these stories where it's not only them that are being abused, it is also their children. And so we would try to, of course, tell them things to let them know that we are doing all that we can and this is still a safe place. But that fear of the unknown, it really prevented them from seeking that additional help. It really prevented them from coming into the shelter because they're like, you know what, even though this person is threatening me, even though this person is doing whatever to me, I at least know what I'm facing. I can't put my kids in any more risk by leaving what I know and coming into this place, and I don't know what people have. I don't know what people are doing. And so that was a huge barrier for us. So our intake process became a little bit more intensive because we had to do a lot more safety planning with them. We had to provide them with a lot more information and let them know what we could provide for them in a safe way, and if they chose to get out, how to do that safely. Because the other issue then became when we did get people who were willing to come into shelter, how are we getting you out? Because guess what? Your abuser's there. He's not going to work. She's not going to work. They're there with you. So safety planning had to look different with the callers. So now it's about getting creative where, okay, maybe there's a day that they were allowed to go outside to get food for the children. So maybe that would be the day. Or if you had, that was the day that the abuser would actually go out to do something, we would have to coordinate with them to get them to come in at that particular time. So we had to get a lot more creative with how people would leave because that was a big barrier. When we got people in, what we realized is that the additional social distancing to them just looked like isolation. And so you had a lot of residents complaining about, you know what, I was isolated by my abuser, and here it is again that I can't even get out. I can't even come out to interact with my peers and the new friends that I've made within the shelter. And not even that, just also with the fear of I'm scared to come out my room because I'm not sure what's going on with my roommate, or I'm not sure if my roommate is doing the things that they need to do. And so this began to bring on an additional worry for them and an additional anxiety. We also had those that were dealing with the loss of family members. And so, again, when we have victims who come into shelter, unfortunately, in efforts for their safety and the safety of their children, we ask that them really limit their interaction with their family and friends, because unfortunately what happens sometimes is when you disclose your location and you go and visit your family and friends, this is how your abuser is able to locate you and find you, whether it's through following you back or maybe somebody slips and says something. And so since they already had that happening, now they're even more fearful because we can't go outside. I can't go and be with my family member who's sick. Usually if I wasn't here, I could be a support for them. But at the same time, I don't want my abuser to find me. I don't want my abuser to harm my family anymore. And so the additional guilt of that weighed on them heavily, especially if they end up losing someone as a result of COVID, because they're thinking, well, I should have been able to be there. And then the mental health issues, that definitely increased. We saw an increase of that. As we know, for anyone with dealing with COVID, it really brought on additional anxiety and stress. Just, again, the fear of the unknown, which is a big thing, and I'm going to keep saying it. And so not knowing what's going to happen. Is it safe for me to go outside? Is it safe for me to go to these appointments that I have to go to? What does this mean for my children? And even being confined to the small spaces. Unfortunately, the shelter spaces aren't that huge, and so now you're confined to this small amount of space, and so it triggers memories of past trauma, which then triggers anxiety, depression, and some of the symptoms of PTSD. So you have that happening with a lot of not only the parents, but with some of the children who are having a hard time, because you may have a family of 5 who is now confined to a 2-bedroom apartment. And so the spacing is too much for this child. The child is overwhelmed They don't have the space to go and release, and they don't know how to express themselves properly. And so, unfortunately, this has also triggered a lot of issues within the children, where we've seen that we've had to have children end up going to the hospital, or we have to do crisis calls for the children just because they're not able to maintain in the setting that they have. Next slide. Next slide, please. Thank you. And resurface feelings of powerlessness. It's a lot of the families, it's again the unknown. So when the plan normally, when they come into shelter, everyone has a plan. They say, you know what, this is going to be a new start. It's scary for me. But guess what? I'm going to go. I'm going to get a new job. I'm going to file for my immigration. I'm going to get this divorce. I'm going to get into a new housing program. I'll be able to go back to school. And then COVID happens, and guess what? Everything is shut down. You can't go to public assistance. A lot of the housing programs were not open. But when it came to anything legal, it was only a lot of the immigration, divorce, all of those things were put on hold. And so now they're feeling as if, did I really do the right thing? Did I do the right thing? My time here is limited, and would I be able to accomplish anything in the amount of time that I need before it's time for me to go someplace else? Am I going to have to end up going back to my abuser because I can't get a job because who's hiring right now? I can't find housing for my children because, unfortunately, I have no income, and I'm relying on NYCHA. I'm relying on Section 8, and those offices are closed. My immigration is about to expire, and I can't get in contact with anyone to see what's going to happen with that. He was right. Oh, my goodness, this man was right. I'm going to have to go back to him. He said it. If I left him, I'll lose my immigration. I would lose everything. And this is what it looks like to them because, unfortunately, sometimes they don't have all of the information, and this is where the staff comes in and is able to provide them with all the resources and things that they need. What we also saw was that, again, because of the stress of COVID and the fear, and also with people who who unfortunately tested positive for COVID, there was an increase in their medical conditions. So we had those that had seizures who were having seizures more often as a result of the stress because that was something that triggered their seizures. And as you know also that a lot of the medical conditions, if it wasn't serious at the time before COVID, the hospitals weren't even meeting with you. The doctors weren't seeing you. So a lot of these issues that may have been a little bit, that would have been smaller initially, as COVID has gone on, it has become major issues. And so we saw an increase in those conditions. And then just adjusting to the new appointments and the procedures. A lot of things were face-to-face because the clients relied on the support from us. Like Lenny said, sometimes just seeing our smiling face was enough to get them through. Sometimes just being able to see someone who they believe cared or just to get that encouraging word. It's not always just the verbal, it's that physical, which we realize is so important to our clients, especially being able to interact with people because a lot of them, that was taken from them. And so not having that anymore was very difficult for them to adjust to. And so now we're saying, but we're available by phone. We're available by, we can practice social distancing at some point. That wasn't enough for them. They really missed the interaction with the groups and all of the things that we do face-to-face, not only for just the parents, but for the children, the socialization, so the parents were able to get a break from the children because now you have school remotely, so they're with their children all day. So, again, you have families as big as, you have with maybe someone with one child, but then you have someone may have 6 children, and they're all in this small space all day. It drives them crazy. A lot of parents are like, oh, my goodness, I didn't realize my child had this personality. I didn't realize that this particular one didn't get along with that particular one. Some people realized that they didn't like things about their siblings. That was a lot for them to deal with. And even trying to understand the computer. A lot of people were not computer savvy. A lot of people were worried because a lot of shelters, they don't have internet access. They don't have Wi-Fi. So how am I supposed to do remote learning with my children? How am I supposed to do my virtual appointments, the psychiatric appointments that I need and my children need? The shelter doesn't have Wi-Fi. So how is that supposed to happen? So there was additional stressors about that and in being able to support my child because guess what? I don't even have a high school or 8th grade education. How am I supposed to help my high school senior with her classes? So those were some of the things that some of the parents were fearful of. So what we did was we definitely had to change our procedures, and it really is, and I put the 4 arms, and it's the 4 R's of trauma, and it really is about just really keeping the clients informed. And so the first thing really was for staff, because staff is coming in every day and they're dealing with clients who some are receptive to what the rules were with quarantining and social distancing, and then you have some that weren't. So we wanted to make sure that we supported staff in any way that we can. We made sure that we increased their trauma awareness and interacting with not only the clients, but even being in touch with themselves, because even the commute to work for staff was traumatic for some of them. So they had to kind of be able to know if maybe when I came in the morning, I need a minute before I can start interacting with clients, because I don't want to bring my things in from what I just experienced. Or maybe they have their own personal things going on as a result of being impacted by COVID and not wanting to be triggered by a client who is having something similar going on. So just making sure that they are aware of what they were feeling at all times and how to respond appropriately, making sure that they were educated and making sure that there was compassionate resistance. So then we increased the cleaning in our facility. We provided masks for our clients. And so one of the things is, especially even letting clients know that this was what we were doing, that helped so much. And the fact that they saw that every hour on the hour someone was cleaning, it made them a little more comfortable. So guess what? They weren't staying in their apartments as much, because they knew that at least when I walk outside my apartment door, it's clean and it's safe. And so maybe I can get that little face-to-face with a staff member because I'm feeling overwhelmed. And again, with the service delivery, we had to start to do things virtually. We did a lot of telephone. We practiced social distancing, utilizing PPE. Fortunately, my agency did provide the staff with masks and all the things that they need. And then we also got creative because, we also did want to interact. So a lot of what we did, we purchased a bullhorn, and, my building is a 5-flight walk-up where I work. And so we kind of talked to the residents that way, and they were able to kind of peek out through their doors and see us, and they told jokes, and they loved that more than being able than the telephone conversations, because they felt that they can still see us. Maybe now we're on the floors with them and standing on the bases of the floors and interacting. So just kind of changing how that was done and letting them know that they still have to keep their mask on and social distancing, and it helped. And we did limit the interactions with outside service providers, because we definitely do believe in continuum of care. However, again, with a lot of outside service providers, ACS, preventive services, a lot of supports, we did have to limit how much of that we allowed into the facility. And then when we did allow in the facility, if there was a need, because it couldn't be done virtually, we did have questions that we had to ask them, and we had our additional screening questions, and everyone did have to have a mask. And then again, just the general safety planning, similar to what Lenny already mentioned, so I won't go into all of that. And so the intervention, like I said, we wanted to make them know that what was going on at all times. And if we didn't know something, we were okay with saying, you know what, I don't know, but I'll get back to you. That made them feel better, because they understand that no one knew what was going on when it came to COVID. So if we always had an answer, they would start to look at us like, oh, okay, you're just trying to appease me. I don't know. I don't feel too confident. But if we really, truly didn't know, we would let them know that we didn't know, but we would make sure that we would follow up with them to give them the right information. And we made sure that we kept them involved in the services. So we asked them what they like. So what is working, what isn't. So one of the things that we found with the telephone sessions was that a lot of things they were taking because of the tone of someone's voice, they were taking out of context. And so we had to be more mindful of that. Because normally when we would say things a certain way, they would see the facial expressions and know that we don't mean anything by it. However, now, because it's over the phone, they're not sure. So we were able to take that feedback and change the way that we did certain things. Or maybe that meant that we had to figure out a way to see this person face-to-face while practicing social distancing. And then keeping them informed of their choices. Yes, you wanted to go to school. Guess what? That school hope is not lost. Let's plan for another way to do that. We can still have school, and we can do it through internet. My agency fortunately provided Wi-Fi for all of the families in the building, so that helped relieve a big stressor for them. And so this was able to connect them to their services in another way. And like I said, the meeting with each other, the groups, was so important to them. When we were able to come onto the physical floors and at least have them in their doorways and still do, like, they were like, I didn't even think of doing this. At least now I feel a little bit more connected. I feel I have a support. I feel like you guys care. And I think this can work. I think we're going to be okay. And then again, just keeping them empowered and just keeping them motivated, understanding a lot of self-care, a lot of the basic things that everyone is being told. You know, watch what you look at. You know, you want to look at only reputable things when it comes to COVID. So you want to look at the CDC. You want to make sure that you're only getting facts. We want to make sure that we provided them with information on things that were important to them and making sure that they knew where to look to get the information themselves, so they wouldn't have to be nervous about, oh my gosh, if I don't go to public assistance for my appointment, they're going to cut my case off because that's what everyone's telling me. No, we have it posted, and we also tell you where to look. So we want to make them understand that, and just also keeping them very much aware of COVID and the symptoms, because again, you have the panic about, oh my gosh, I have a cough, I have a sneeze, which some of us went through on our own. I have COVID, so now I'm fearful. No, we made sure that before, when we first heard about COVID, we sat down and let them know what the symptoms and the signs were. And so we can just refer them back to that. We had them posted big, huge throughout the facility and also provided that to them. So a lot of the information that they would need and what we would use to be able to calm them down and make them feel better is we would physically give them this information and we could refer them back to it. If you don't believe me, remember that form that I gave you 2 days ago? Remember that form I gave you last week? Look at what it says. So this is what could help you through this process. So one of the things, we learned a couple of things. So one of the major things we learned, of course, is that COVID-19 has disrupted the social and family life in unprecedented ways, right, in ways that we would have never imagined. And the other thing is that the tools of the power and control has changed, but the dynamics have not. Abusers have become very creative in how they are exerting their power over the victims. And it's scary, but because we're now aware of it, we utilize that in our conversation when we're doing intake, which makes them more comfortable to say, you know what, maybe I will leave and come into the shelter. The risks to survivors and children have changed, but the risk factors have not. There has been an increase in domestic violence throughout COVID. And so, unfortunately, you know, a lot of people are still not aware of the services that we provide. And so the risk is definitely still there. Benefits of integrating a trauma-informed approach during COVID. I really believe this is what helped us a lot because because we came from that perspective, it really helped us start to do our service delivery change. We must learn that to provide individualized support, advocacy, and self-planning. And so again, what we learned was that what works for one is not going to work for the other, which is what we learned generally, I think, in working in the social service field, but especially in dealing with trauma. So for example, one of the things that we implemented was daily check-ins, but that didn't work for some people. The check-ins made some people more anxious. And so we couldn't do that for some people, and we realized that, but some people needed that so that they could be okay. And so sometimes it will take that additional step to make sure that everyone is feeling safe and everyone is comfortable. And being open to non-traditional and creative ways. I've always been an advocate to do things non-traditionally. Everything does not have to always be, I'm not always about the face-to-face interaction. Let's get creative. You know, if I have to stand in a stairwell and do a group, then that's how I'm going to do it. We need to get a little bit more creative, especially when you're in the shelter, because our spaces for some shelters are limited in how we can interact with the client, but we still need to provide them with the services. We still need to provide them with the support. So sometimes we need to think outside of the box to figure out how we can do that. And the benefits of resilience and coping skills, because I believe that the coping skills that we've taught the clients is what's really helped them get through throughout this whole pandemic, and just keep them motivated. And again, this is not just through the pandemic that we use these skills, but it has been an increase. It has really helped push them forward, and the clients have provided us with that feedback. And the other thing is that there's definitely a need for more resources to support healing in communities that are vulnerable before the pandemic, support the frontline workers tackling the physical, emotional, and physical impacts of COVID, and strengthening services to those who experience domestic violence. Because unfortunately, as you're sitting here, and a lot of you may know about domestic violence, there are still a lot of people who don't. And so we need to get the word out there so that we do not get calls with people who are still coming in to this day who are saying, I did not even know that this existed. And so we need to make sure that not only is that there's more information out there about domestic violence, but especially when we're dealing with other things like this pandemic, how can we continue to support these issues? And that's it. Thank you so much for listening to me.
Thank you, Kellee. That was amazing. We're going to move on to our Q&A with Diana, who will be facilitating. We only have time for about one question, and then we'll get into our Let's Chat.
Yes. Hi, everyone. This is Diana, part of the CTAC team. Certainly want to say thank you to Lenny and Kellee for all of their really informative experiences. I think that definitely shapes where we are right now, right, and how you both have to change things around to really attend to those that you work with. So one of the questions that came in is, for example, we know New York City schools have said that for the fall, there's an option for families to either do it remotely. So one of the questions that came in is, knowing that this might be an option in New York City, maybe at other points throughout the state, how do you see your clients, families, being affected in the fall? Anything different than what's happening right now in the spring?
I can talk a little bit about that. I mean, I think we may be seeing the same type of percentage issues at the same time. When we think about transitioning back to a new reality, I think adjustment disorders or adjustment reactions to the new system may be something that we'll have to look into. You know, for young people, the reference that they have is what they lived before, their previous experiences. So how it's going to be for them to go back to an environment that may be different, right? So prevention then will be key, but also, you know, at least from the crisis side, schools uses a lot for any situation that may come up with them. So I don't know if that answers the question clearly, but I will anticipate that in the light of transitions, there may be some adjustment reactions to it that may be different to what we're seeing now or in a different environment.
Thank you, Lenny. And Kellee, I don't know if there's anything that you want to add to that, maybe any changes, you know, for those that are in DV with family, how that might affect if there's any children?
Yes, so I definitely think that it would continue to impact our families. One of the things is that a lot of people have small children. And for example, in the shelter setting, if you were home, you could leave maybe your 14-year-old to monitor your younger children while you ran out to the store, you did something. You can't do that in a shelter because who really, if anything's happening, it falls on the shelter staff, and you may not have staff to be able to monitor that. So it would be within, for us, we would have to kind of help them to get some things in place so that they can be able to adjust to that. What is that going to look like? Additional support to them. How could you support them through that process? And then again, just really working with them to just be accustomed to being in the space. The space is a huge issue, and what kind of has gotten them through is that they felt like this is only temporary. This is only for a couple of months. But if they know for a fact that this is going to be for the whole school year, I think it's definitely going to impact them again mentally. And so we want to make sure that we have the supports for them that they're going to need.
Great, thank you so much. We did have a couple of questions come in. We do recognize that we do want to continue also with some of the other questions. So I'm going to turn it over to my other colleague, and we can maybe try to blend this in.
Thank you. Thanks so much, Lenny, and thanks so much, Kellee and Diana. I really think that you have given us some great insight into the lives of kids and families in the day-to-day, as well as the lives of providers. And I just think that I commend all of our providers, and I know that our families are so lucky to have people like you in their lives as well as others. So we're going to move on a bit. We don't have time for everything, so we're going to move a little quickly. So we are going to hope that you're chatting in with us. If you don't chat in, we're just going to keep moving for the sake of time. So let's start with our first question. Deborah, do you want to take over?
Sure. So my name is Deborah Katzman, and I work with the Silver Institute, and I'm happy to be a part of the CTAC. So we're interested in how you are promoting safety with your company. How are you attending to safety and crisis experiences in your work? And what have you done to intervene during your crisis or to increase safety with your children and community? Okay, so I think it's important that we hear from you and so that we can learn from each other and to protect children and families during this challenging time. If you'd like to in the chat, that would be wonderful. I'll give you a moment to think about safety with your client.
Deborah, I think your audio is cutting out a bit, so I'm just going to chime in here. So
Sure.
we were wondering if you wanted to share how you're attending the safety and crisis experiences in your work. So feel free to just chat in if you can. If not, we'll just move on to challenges with Dr. Rodriguez.
Can I say something quickly?
So if I may, while we wait for people to chat in, I actually wanted to throw another question in here for both Lenny and Kellee, and that is, of the experiences that you've had, so the lessons that you've learned, what are some of the lessons that you think you're going to carry forward in your work after this crisis passes? What do you think are lessons that you're like, oh, I'm going to do this all the time, and I need to do this all the time, or more than I've done it in the past?
I think that there is a meaningful, very meaningful, I don't know if there's something that will carry, but it will stay because there is no way back. There has been like a very meaningful connection with, as a team, I think from the piece of like clinically thinking about how we deal with our cases, that has made us closer for sure. We've been meeting before, it was like one a week, and now we're meeting 2-3 times a week. So definitely I would like to carry on the uniqueness of our work together. And I do think that with the families that, the virtual world had his good things and the things, for some youth that they're shy, they tend to isolate. Perhaps they respond better when they have their device, that because we do know that some of them prefer. So we may have some openness to continue connecting with some of these youth that way.
Great. We have had some responses from the audience, so I just want to make sure that I share them. And one of the responses about their own experiences with dealing with safety, they said, our program has been conducting home visits to our families, and we are continuing to provide support and assistance with information and curriculum that is with our program's protocol, and their program is Healthy Families in New York. Another response was that I've had clients whose landlords threatened to evict them during the pandemic, even though their rent was at least partially being paid through public assistance. Landlords cut off power, heat, and water to try to force people out, knowing that evictions are against executive order. I've intervened by connecting them with legal services and with the housing authority and code enforcement. Well, that is extremely distressing to hear that landlords are threatening eviction when there should be a hold on evictions right now. So that's got to be very distressing practically and emotionally for families when we're dealing with so many challenges during this time. I appreciate both of you sharing your experience. Thank you.
Thank you, Deborah, for sharing. Those are really important, and I agree, very distressing. Let's move on to some challenges. Jen, do you want to take over?
Yeah, we also wanted to give you an opportunity to share your challenges. And what are you experiencing at work with your clients? I know Lenny has talked about working with children and families related to crisis and crisis mental health services, and Kellee about victims and survivors of domestic violence. What are your experiences? What are the crises and safety issues that you're facing with children and families in your work?
You can just chat in the chat box so we can share with everyone.
I'm seeing one response here. Challenges we face in our program have that families experience basic needs, like for diapers, formula, and for their babies, and they have limited funds to provide these basic needs. Any other major challenge? And I'm curious for anyone on the panel, Kellee and Lenny, have you had issues with meeting basic needs, and how do you address those?
So we've actually been fortunate. We have a lot of resources who would donate things. So one of the biggest issues, definitely, like one of the participants wrote, Pampers, formula, things like that. And so we were fortunate enough to have someone who donated a lot of formula, Pampers, things of that nature. And then we started to kind of see what clients needed and what they were asking for more than normal. And we were able to fortunately order those things and have them on site for them. And so it was really just making sure that we had the supplies and that we rationed them out in a way that everyone would have access to it. And so because we were able to do that from the beginning, I think that was able to kind of keep people calm, especially like with food and things like that.
Yeah.
And just trying to figure out and ways to be creative in supporting the clients, you know. Initially, that was a little bit challenging for us because we did not know, you know, we knew very little about COVID, and everything that we do is face-to-face. It's an apartment space, so we're right there with the clients. And so we just had to really get creative in how we would continue to support them through the process. And we just went back to the old-fashioned way of providing paper and using the telephone, and so we were able to work through it.
Yeah, it seems to me that programs getting creative with how they develop and connect with community programs and other services that are out there, whether they be folks who are working with volunteering in programs and communities, is going to be an increased need. I think that some of these needs over time. Kara, I know we're at time, so I just wanted to.
I know.
There's
so much more. Thank you. There's so much more conversation to have. Let's chat. Your own safety and well-being is something we really wanted to spend a few minutes on. So we don't have time, and we want to make sure that we have time to let you go. But I just wanted to emphasize, as Lenny mentioned, the importance of self-care as a priority. And please feel free to email us at ctac.info@nyu.edu if you have any thoughts around your attending to your own challenges and well-being that we could support you with. So please feel free to email us. I'm sorry we didn't get to have a discussion around this. We're going to wrap up. There are a lot of resources that both Lenny and Kellee have shared with us. These are just a few around domestic violence, education and activities, and food resources. We are putting all of these in a document, and we'll post them with the slides, as I mentioned. And lastly, I just want to thank you. I want to thank you again as essential workers, and I want to thank you, Kellee and Lenny, for participating with us. If you have additional questions, please contact us here, ctac.info@nyu.edu. And please feel free to email us, as I mentioned, about your own safety and well-being and how you're attending to it and any support that you could use. Our upcoming events, we have several of those happening. Here they are listed. Please visit our website for other information. And I just want to thank you all and have a wonderful rest of your day. And we hope to see you soon. Take care, everyone.
Bye, everybody.
Thank you.
Bye.
Bye.
Thank you. Bye-bye.